I have a story to tell. I'm inspired by a talk by a little resuscitation group that I have from all my former residents I've worked with and now are attendings or still residents, still asking questions. Only one resident probably knows, former resident now attending knows about this case. So imagine you pull a curtain after someone tells you that there's something wrong with this lady's airway. Like something's wrong with it. And you pull the curtain. You never know what you see when you pull the curtain. Never know. When you pull the curtain, you see this lady. I'm going to tell you, the tongue, right, should be down here. The tongue shouldn't be kissing, caressing, being intimate with the roof of the mouth. And then you try to look below, and there's swelling below the tongue. When you feel carefully, there's like a jowl, not a chubby jowl that's jiggly, but red and indurated and swollen and tender. So if you see it underneath the chin, it's called submental. Underneath the tongue, sublingual. Underneath the jawline, submandibular. And extended out this way. She couldn't talk. You can hear her talk. No, you couldn't hear her talk. You could her breathe. Now it's a whack grunt. But they're not grunting like animals in the wild. They're grunting like human animals with Ludwig's angina. That's what she had. Without a CAT scan. Now I'm going to tell you this. A lot of surgeons won't do any operation, like an ENT surgeon, without knowing the extent of this. Or, if they do the CAT scan, they'll do it after they get a definitive airway. Now, not many people are going to take this patient directly to the OR without any labs, without vitals. I'm going to tell you that. Especially at 3 o'clock in the morning. But when it's like banker's hours, Monday through Friday, 9 to 5, things may change. So I'm going to tell you this. I know how surgeons think and how extensive they want to know the extension of the swelling is. So a CAT scan was done. Miraculously, I went with her. I did not and luckily our CAT scanner is 50 feet away from the resus room. And if it was more than that, I would have traveled with her, and I don't care how many patients in STEMIs and code sepsis or code hearts or seizure patients came in. This is the sickest patient in the emergency room and in the hospital, in my opinion, because this one has a pulse. And I just met her, and no one knows anything about taking care of her. And this patient was not brought in by ambulance. This patient was brought in by a family member who was concerned. The son was so concerned that this patient may have had an infection somewhere that even crushed augmentin and tried to feed it the applesauce to this patient. And the patient didn't want to even come to the emergency room. Now this is going on for a week. A week. I don't care what the vital signs show, that this lady has some compromise going up here. It'll be, there's trismus because there was so much swelling. Not that she had a broken jaw. She spiked the fever. Yeah, we can give antibiotics. That's not. It's too late. You have to do source control, damage control, infection control. Get rid of the abscess, the collection of pus. Later on, pull her teeth if she survives the treatment. I've seen CAT scans that the sub-Q air and swelling and edema goes up to people's scalps. Wasn't that bad, but she had an airway issue, and she needed treatment.